programs incorporate Eastern and Western knowledge to provide information on health, nutrition, exercise, stress reduction, and energy medicine. They are designed to further the understanding of the mind-body connection and the improvement of general health. The information contained in this video is not a recommendation or therapy for any particular illness. For optimal health benefits, please consult your physician.
Five or 6 years ago, I began to experience some pain in my neck. It was right after I had my wisdom teeth removed. I didn't know exactly what was wrong or anything. Within a few weeks after I had the teeth removed, though, I began to feel some pain right here in the back of my neck. I went and I had some x-rays done, and no one could seem to find anything. I started seeing a chiropractor. I even saw a neurologist because I started having some numbness and everything. And finally, I just kind of gave up. No one could seem to find anything, and I just let it go. And then a few months later, it started bothering me more. I started going for some physical therapy, and while I was having the physical therapy, the head physical therapist at the hospital mentioned to me something about he thought it might be a TMJ problem or related to some kind of problems with my teeth. So he referred me to a dentist who I went to see, and they did an MRI of these joints and found that I had severe adhesions around both of the joints, but particularly bad on the right side, which is where I seemed to be having all the pain. And at this time, it had spread not only from the back of my neck up into my jaw and partially into the side of my face. And so I was referred to a specialist who did surgery, and he said that I needed to have the adhesions removed. I went in and had those removed and went through about 3 months of physical therapy. For 6 weeks after the surgery, I could only eat flesh, the really soft foods. Lost about 10 pounds, which was fine with me, but I was still in a lot of pain. In fact, after the surgery and after the physical therapy, the pain became worse. I had this terrible muscle spasming all on the right side of my face. It was painful to eat. It just bothered me chronically. And I felt like I was about ready to go out of my mind with the pain. I didn't know what to do. We heard about a specialist who kind of handled these TMJ problems, and a dentist and down in San Diego, and I went down there, and they did find that I did have a severe malocclusion. They did complete bites of my mouth, and they found that what they needed to do, or his theory, was to go in and totally to reconstruct the mouth. And his way of doing it was putting gold crowns into the mouth. So I went through months of dental treatment, sitting in the chair with my mouth open, very expensive, anywhere from around $10,000 to $15,000. But I still continued to have the pain, and I didn't know what was wrong with me. I felt like I was getting sicker in the long run. My coloring was really bad. I had no energy at all. And this facial pain was worse than ever. They did a brain scan, and I found out that I had a pituitary tumor, which was causing something that they call Cushing's disease. And it basically causes a whole imbalance of all the hormones. None of my hormones were right. Things were way too high. My thyroid was way too low. They immediately scheduled brain surgery, and I was in the hospital for 12 days with that. Again, very expensive, probably about $50,000 for the surgery, including the surgeon's fees, the hospital fees, and everything. I came out of the hospital, and within a few weeks after all the pain medicine and everything, the anesthesia totally wore out of my system. The pain was worse than ever, and I started taking Dilantin, which is a very strong nerve medicine. I was taking some muscle relaxants, basically anything I could do to get through the pain. It was very frustrating to me. I don't like to take a lot of medication, but I had no other choice. The pain was that bad. And then I went for a couple of consultations with neurosurgeons about having the trigeminal nerve doing like a block or having something injected. And they both said no, that they would not do that procedure because they didn't feel that I had trigeminal neuralgia. So I had varying, opinions on what the problem really was. And at this point, I didn't know what to do. I wound up going to UC Irvine. I was there. I consulted with a neurosurgeon there. I wound up going down to Scripps in La Jolla and saw some rheumatologists and neurologists there, and was just about at the end of my rope because it was getting worse and worse and worse. They did another brain scan and found at that time that I had a large cyst in my right maxillary sinus, and they needed to take it out. They didn't know whether it was benign or exactly what it was. I had that scheduled and went in for surgery. Was in the hospital for a few days with that. They went in up through the sinuses to take it out, but they couldn't because it was too large, so they had to go in up through my mouth and slit into the side of my cheek to take it out. Turned out to be about the size of a $50, and it was round in shape, so it was basically about the size of a golf ball. I had been sent to UCLA Medical Center, saw someone there, and they said that it was diagnosed me as having thoracic outlet syndrome. I had an MRI done there, and it showed a narrowing of that thoracic cavity on the right side, which they felt was causing a lot of the pain going up into my neck and up into my head. And they wanted to do a nerve block, and we were just about in the process of scheduling that. We were in touch with an anesthesiologist at UCLA, and I started not feeling that well. I thought I just had a case of the flu, and I went to see my regular family doctor, and much to to my surprise and to my husband's surprise, found out that I was pregnant. I immediately quit taking all the medication that I had been taking because of the baby, and the minute I did, within like a week or so after, I could really tell a difference. The pain started to get worse than ever.
It is obvious Lisa's problem will never be resolved with drug or surgical treatment. Her facial problem, the TMJ, the dental problem, the polyps, and the tumors are all complications and symptoms of a disease. So for 5 to 6 years, experts have been treating the symptoms of a problem while ignoring the underlying cause of a disease. I hate to guess how much it cost her for the last 5 to 6 years. I would hate even more to estimate how much it would cost her for the rest of her life if she continued the same kind of treatments. Now let's see what happens if we approach a problem by combining Eastern and Western method of treatments.
I went again to see my rheumatologist, who said that he had heard about Dr. Tong and had heard that he was successful and that he did get a lot of good results. And he said that he felt that it would definitely be okay for me to go and to see him because he would be able to do treatments and do things to me that did not involve medications or drugs or anything that could possibly hurt the baby, but yet very possibly help to relieve a lot of the pain that I was having. And after just one treatment with Dr. Tong, I was very surprised that I did feel much, much better. I could definitely see a big sign of improvement, and just now, after only 2 to 3 weeks of treatment, I just feel so much better. I can see at least 60 to 70% improvement over my condition, and I feel very confident that with continued treatment that I will be able to get this problem once and for all under control after going through 5 years of chronic pain with this.